Committee. Uh, I'm joined by by my co-chair as well, Wendy De Leon. So thank you all for joining. I know it was a little bit of a short notice, but we're really happy to have you. We are going to be presenting on family support services, specifically reimbursement. It's one of our more underutilized services, and we really want to make sure we're sharing out the information about reimbursement to everyone that joined, families that we support, care managers, provider agencies, and so forth. So I'm going to do a presentation on family support services of reimbursement. And then we're also going to have a few presentations by some provider agencies that actually do work with families and care managers to support family reimbursement in Manhattan. Any questions if you have, if you can put them in the chat. We'll try to also make this as interactive as possible. So if you also have any questions that you want to ask, please feel free to use the hand raising feature. And as time permits, we will try to get to everyone's questions, okay? So again, thank you so much for joining. Sorry, I cannot mute my chat. I'm trying to make sure those don't come up. So family support services, all the information that I'm going to be sharing here today can be found on our Manhattan DD Council website, which I'll be sharing, which is going to be shared on the slide deck that we share out later today. We'll also put the link in the chat as well. And again, just please note that not all family support services require that you have OPW eligibility. However, in order to take advantage of reimbursement, you would need to have OPW eligibility. So what are family support services? They are services available to families to help enhance a family's ability to provide in-home care to their family members with an intellectual or developmental disability. This includes goods, services, subsidies as determined appropriate by the family, the service provider you're working with, and OPWDD. Specifically for reimbursement, as it's available, it is subject to the requirements contained to enhance a family's ability to be able to provide in-home care. So a little bit more, family reimbursement through this program is a resource to families who don't have access to the funding sources, and as a limited state resource is intended to be funded when other options are not available. Reimbursement through family support services may only be provided after families have sought funding through all other funding resources. So any private sources, early intervention, school services, FSS services are to be prioritized to support families of individuals who are not enrolled in the OPW waiver. I think someone is unmuted. If everyone can please mute themselves. I get distracted very easily, so it's a little hard when other people are talking in the background. I'm sorry. How can family reimbursement help? So it helps families pay for items and activities that support their child or person receiving services. It offers flexible funding for things that usually aren't typically funded through OPWDD. So ideally, families can access respite, ComHab, DayHab, supportive employment, but other out of the box services like community classes, swimming classes, other needs that someone has that could help support a person with intellectual developmental disabilities live a more fuller life, ideally can be reimbursed through family reimbursement, as it helps to reduce the out-of-pocket costs related to caring for a person with a developmental disability. And again, some more examples could also be summer camp, an after-school program that comes with some type of cost, recreational activities, purchasing sensory items, adaptive equipment, some learning materials. It can also cover related transportation, respite-related needs, or household items that support family stability. Not every agency covers such costs, so you have to definitely check with the provider agency that you're working with when you're looking to access family reimbursement services. OPW also does have an allowable and non-allowable list that you can find on the OPWDD website, and I also have added the link here. Again, if you're looking to look at it right now, you can do a quick internet search, Google search on OPWDD allowable, non-allowable list, and it will come up. It should be the first item that comes up in the search engine.
I do just want to jump in here and say it's not an exhaustible list. There's always things that come up that maybe the first time that a provider agency or even OPWDD may be hearing about it. So if you're not sure, if you don't see it listed, please do reach out to the provider agency where you've applied before, or any provider agency that will be presenting or mentioned here today, as well as your care manager, and they can follow up and see um, if possibly it's something that could be covered. I will say this, things aren't covered until they're covered. And what I mean by that is you can apply, right? But until OPWDD approves it, right? Um, you won't know for sure that it is covered. So please don't purchase something with the idea that, oh, this will definitely be covered, if you're not, because they can't give you a 100% guarantee. So always do keep that in mind. But, you can always check around with all the resources available to at least get a better sense of where you could find that support. Sorry, Manawati, I went a little
That's that's okay,
on
Wendy.
a
Thank
on a tangent
you.
there, but I just wanted to make sure that's the case because I know many times we apply for things assuming that, oh, know for sure I check off all the requirements, but there may be other things that don't allow for them to cover 100% of the cost, or the item at all. So, it's always good to check.
Thanks, Wendy. No problem. So how can your care manager help you? So if you already enrolled with the care coordination organization, you should also be assigned a care manager, and your care manager can help you with accessing family reimbursement, explaining the program to you, providing you with that allowable, non-allowable list, the application, and so forth. And so they would also help better explain all of the parameters surrounding family reimbursement, which is also public information available on OPWDD's website, where you'll find the administrative directive memorandum discussing the parameters around family support services of reimbursement. There is a spending cap for family reimbursement and how much would be approved, up to how much would be approved. So the fiscal year, the family reimbursement for Manhattan runs on a fiscal year, which means it's from right now, July 1st, 2025 until June 30th, 2026, which also means that any items that you're looking to get reimbursed have to have been purchased during this time period. The cap at this time is up to $3,000 per contract year. Applications for reimbursement, again, have to be completed within these dates that I provided, as well as whatever you purchased or whatever you're trying to get reimbursed has to be between those dates. Reimbursement will not be provided for items and services purchased in a previous or upcoming contract year. It is strongly encouraged that all reimbursement requests that occur towards the end of the contract year are submitted within 90 days of the start of a new year. So if you're looking to submit closer to the end of June 30th, you want to get those in as soon as possible because funding, it does tend to run out as you get closer to the end of the fiscal year. The timely submission will help support the processing of reimbursements within the appropriate contract years.
Yeah, I also want to jump in there, and just mention, check with the provider agency. Every provider agency has a certain stop date. I know for Adapt Community Network, we this year are trying to make sure everyone has their application in by June 1st, so that it gives us time to process the applications, believe it or not. And I think this is the case with several agencies. We get a sudden influx on June 30th.
Mhm.
OPWDD only gives you a certain amount of days for a provider agency to process these applications and submit it to the DDRO, for review. So that's a process. And if we are not able to touch your application, have it stamped as a June 30th received date. Your application just may not be processed. And we hate to see that. And I'm sure I speak for all the provider agencies when I say that. We would hate to, have to say no to someone just because the paperwork wasn't in a timely fashion.
Yes, absolutely. Thanks so much, Wendy. Um, so as well as being able to submit receipts, there are some instances where families can apply for direct purchasing, being reimbursed directly to the vendor. So if the family is not able, in some scenarios, to pay directly for the service, obtain a receipt, you can work with your care manager and the provider agency doing the reimbursement to see if they would be able to process an application to be able to pay the vendor directly. But again, this is a case by case basis. Adding here some currently what are the reimbursable goods and services per OPWDD's website. We'll have again some presentations by our provider agencies that may be able to go into this as well. We also do have some allowable one-time reimbursements, which a few could be a rent arrears, utility bills, food, pest control, home maintenance, emergency respite, and electronic devices. Again, please further review OPWDD's website for specific information surrounding this. For those enrolled in self-direction who may be interested in understanding if they would be eligible, individuals who self-direct and are applying for family reimbursement must include FSS in their self-direction budget. Any reimbursement is counted towards your personal resource account. Therefore, individuals who self-direct cannot receive reimbursement outside of their self-direction budget because you can't have both. It's one or the other. Individuals can only request reimbursement through family support services if funding is not available within your budget. And including here some agencies, all of the agencies in Manhattan that participate in the family reimbursement program. Again, we do also have this available on our Manhattan DD Council website by looking at our family support guides. And that's it. I'm sorry, I didn't want to eat into the time for our provider agencies. So, Casey and Barbara,
Yes.
and Barbara, do you want me to give you guys both access to share to make you a co-host?
Casey,
I don't have
Okay.
anything to share, Barbara. We could just talk.
we can,
Oh, okay. Yeah, that's fine.
I sent the application prior to this meeting, right? So maybe if you wanna.
We'll send it out to everyone
Okay, wonderful.
thereafter. Thanks, Barbara.
Okay, thank you so much. Thank you for having us. Probably been some since in the meeting. And it's good to also talk about the program that is really important and so important for every family that lives with the individual that requires support. And Casey has like a more detailed information. Everything what you said was really helpful, in terms of self-directing, in terms of the application, in terms of the available and eligible items that could be submitted. So we just don't want to, repeat your words because you did wonderful presentation. So, Casey, would you like to present what we offer at AHRC?
She went over the list. The one thing I noted was that we don't reimburse for transportation. So you can't come to AHRC for transportation. We get a lot of applications for reimbursements and do well with getting approvals for any kind of community-based lessons, swim lessons, dance lessons, karate lessons, martial arts lessons, music lessons. The new change with that, though, is that I need you to provide a list of the exact session dates the session duration, and the amount per session. So OPW used to just approve based on a standard invoice, but now on the tracker, I need to tell them the exact date. So I can't just say Casey Barber went to swimming in the month of July. It's Casey Barber went to swimming July 1st, 2nd, 8th, 9th. Each session was $5 and each session was an hour. So that's another layer of information required for that. Other things that come to mind as far as, the the end date is June 30th, as you said. Don't wait until the last minute to submit applications. That's a very important point because everybody does, and then it comes to how many can we squeeze in, put them, get them committee approved, get them on a tracker, get them to the DDRO, get the DDRO to answer us, which also takes a couple days because they're also inundated from all the agencies. So the earlier in the season you can get your applications in, the better. Reminder, so to submit an app, you need the following. You need the completed application, fill in the whole application. A lot of people leave out total amount being requested. So that question number 6, don't just say it's swim lessons. Make sure you put in it's swim lessons for $675 or whatever it is. And then it's receipts. And like I said, if it's receipts for activities, you need that added page that tells us the exact session dates, amount per session, and session duration. If they're clothing receipts, make sure the clothing receipts are legible, and make sure if it happens to be a stapled receipt and you're just showing us a picture of the first page, you also send a picture of the second page because we're doing it electronically. We can only approve charges that we understand, that are legible, and that we can see. Then we go to the clinical justification letter. So you have to tie the need for whatever you're asking for reimbursement for to the IDD diagnosis. Make sure it's an IDD diagnosis. A lot of times, like for something, they might tie it to obesity or something else, but that's not an IDD diagnosis. So make sure it's tied to an IDD diagnosis. Make sure it's signed by the clinician and it contains the clinician's license number. So that's the application, the receipts, the clinical justification letter, then the life plan. Section 5 needs to name AHRC as the FSS provider. It can't name any other agency as the FSS provider. So a lot of times I've got to go back and ask care managers to take off old information that might be on there from years past. You can only name us. And then section 1, the narrative in the life plan, needs to restate what the clinician wrote, tying the need for the item to the IDD diagnosis. And then the last thing is proof of OPWDD eligibility. So include the LOC or the NOD.
Mm-hmm. I just want to add, especially for items that are taxable, if you submit the receipt with taxes on it, taxes are not reimbursable. So we don't want the family then be surprised. Okay. So,
or shipping fees,
yeah,
also not reimbursable. Yeah. Does anybody have questions for us?
I actually just wanted to jump in and clarify a couple of things that you shared, Casey, and thank you so much for being so detailed. Because I think, having the ability for both families and professionals to kind of look behind the curtain and know what this process is like helps significantly. The first thing I wanted to mention is where to get an application. Now, every provider agency has their application or their version of the application where I'm sure like their logo or whatever it is maybe have been added. But you can get the general application from the OPWDD website. Every agency is using that foundation of an application. People may have added a couple of bullet points in terms of the documentation that's required or something to that effect, but OPWDD has an application for this program that they require us to use. The other thing, Casey, you mentioned is a tracker. So I just wanted to I don't know if you want to go into it a little bit or
Sure. So it's just an Excel spreadsheet and it's got about 20 columns for us to fill out. And the data points are like name, tabs, when the application was submitted, when it was approved, the amount that was approved. Then it asked us to state the clinical justification. So we retype what the doctor writes. And then it asks us to state what the life plan says. So we lift that straight from the life plan. And then it asks for in the notes field, we furnish all the information for the clinic for the invoices. So if it's for community-based activities, that's where we'll put the session dates, amount per session, session duration. I'll also indicate if the applicant has been previously approved in the fiscal year because there's a $3,000 cap per individual. So I like to let the DDRO know. It's also good to let them know, hey, you've already approved Casey Barber this year for swim lessons for this amount. So, she should be good to go for this other amount. So they don't have to research and come back and ask us questions about that. Um, yeah, those are the main data points.
yeah, and I do also want to say the tracker is an OPWDD form. This isn't something the provider agencies came up with just to add to the process. This is something that has been requested by OPWDD that the provider agencies must complete and submit in order for them to review and then either approve or deny or come back with a request for additional information or documentation based on what the information on the tracker is. So I just wanted to make sure that families in particular understood that part and
And that it
why.
adds to the amount of time it takes to process an application and
Yeah,
speaks to why you should get your applications in early because this all takes time. A lot of times parents are like, but I gave it to you here. But yes, it needs to be committee reviewed. And once it's committee reviewed, all these data needs to be put on a grid, which takes time. And then the Bureau needs time to assess the information. A lot of time they will go to their committee and talk about it. So the process is lengthy
yes.
and
And
needs adequate time.
Casey brought up another item that I just wanted to touch on a little further, which is the committee, right? Every provider agency, and again, this all comes from the from OPWDD. So every provider agency must have a family reimbursement committee, right? The committee consists of whoever runs the family reimbursement program, has to have a parent as part of the committee. I believe there also needs to be an individual supported, and then whoever else, the program administrator or the agency deems as someone who can add to the process or provide good feedback in the process of reviewing these applications. So please think about this. You submit an application. It's we look it over, it's missing documents, so now we have to go back to you and say, hey, we're missing these documents. Now you need time to get those documents. You send them back to us, right? So now already there's been a few days, sometimes even a week or two, because life happens. Then we have to set up a committee meeting, right? Because the committee isn't just sitting there waiting for an application to come through. So we set up a committee meeting, or some provider agencies probably meet every week or every 2 weeks, depending on how many applications they've gathered. You go through the committee meeting, everyone says yay to this, nay to that, whatever it may be. Then you fill out your tracker. You submit your tracker to the Developmental Disability Regional Office for the respective borough. And then you wait for that DDRO office to review the tracker, get back to you. They may have some follow-up questions, in which case you now have to follow up as a provider agency and then get back to them. And finally, you get an approval from them. And now you submit the check request to your accounts payable department at your provider agency for them to cut the check so that then we can mail it out to you. That's a process, folks.
Process,
That
yeah.
is a process. And that's definitely part of, what we want everyone to take away. that it's not just a simple, the one person or two people you see from the provider agencies here today that can say yay or nay. It really is um, really a village to get through these applications and to hopefully get you the reimbursement for the out-of-pocket costs that you're incurring in order to support your loved one with IDD. Um, so I think that's it, Casey. Barbara, I don't know if there was
Yeah, and I
anything
just
else
want
you.
to finish with
Mhm.
it is in the agency's best interest to spend this grant money. We want to give this money away. We are on the families and care managers' side. We work with you. We want it approved as much, if not more, because every year we get audited and they ask us, are you spending the money? Are you spending the money? And we tell them we're trying, but you're pushing back for this or that reason. So we are there to work with you to get it done, to get all the things we need in order to say this is an approvable app. So please reach out to us with any questions. Don't hesitate. I give out my personal cell phone number to anybody. You can call me and we'll get it done.
Yeah.
Oh, and when you submit an application, please follow up with us in a few weeks and ask us status. There's always one email years later that's like, what's the status? And once the fiscal year ends, we can't do anything about it. And things happen. So please, families and care managers, if you submit an app and you don't hear from us in a couple weeks, follow up with us. Ask us what the status is. We're in it together. We'll get it done.
And of course, if you want to submit the application with AHRC, the point person is Casey. So you can email Casey and Casey will send you everything what you need to submit again, because she is so meticulous and so real, with that.
And anxiety ridden. So come find me and I will get back to you. And I'm putting my email in the chat now. So you can email me
Right,
or call. I'll put my number as well.
right.
I work 8 to 3, so if you call after hours, I'm not going to answer, but 8 to 3. Emails are best. We love a record of communication.
Mm-hmm.
Thank you.
Thank you.
Thank you, Casey and Barbara, so much. So again, Casey and Barbara from AHRC, their information is going to be in the chat. I will also re-forward out. We'll figure out the best way to re-forward out all the their application to everyone on here. And then I had forgotten to introduce myself. I'm actually one of the regional directors for care management at ACA. So for the ACA team, I will do a mass blast of the application to you all after this meeting. Thank you again, Casey and Barbara.
Appreciate it. Bye,
We
everyone.
appreciate you. Thank you. So we're going to now have a presentation by Pearl Rubin from OHealth Family Services. Pearl, I did give you co-host ability, so if you needed to share your screen, you should be able to.
Thank you. I mean, my slides are pretty basic. They're just like the application and the allowable, non-allowable list. So I could not share the screen, I guess, because I know you went through it in the beginning. So I'll just talk instead. And I don't want to repeat what you said or what Barbara said. But thank you everyone for having me. Appreciate being here. So OHealth also has a family reimbursement program. We have one in Manhattan, we have one in Brooklyn, and one in Queens. The process pretty much works the same across all boroughs. The main contact person for that program is Erica Friedman. I supervise Erica, so if you need any, assistance, you could always reach out to me as well. So I'll go through like what the referral process is, things like that. So the first referral process is if you already have the application, as somebody mentioned, OPWDD has a standard application form. So you would fill that out, submit it to OHealth together with your receipts, proof of payment. So that could be like a copy of your credit card statement. Obviously, you could redact everything that's not applicable if you don't want to send us, all your purchases. A justification letter. So certain purchases require a clinical justification letter. So that's like a letter from like a doctor or a therapist. It could be like a school speech therapist if they work with your child. Basically just justifying why your child needs that item. So things that typically require a clinical justification letter are like clothing reimbursement requests, sensory toys, things like that. Recreation activities, things like swimming, karate, gymnastics don't typically require a clinical justification letter. A letter from the parent is usually sufficient. So typical expenses that we can reimburse, as somebody mentioned, recreation items, sensory toys, clothing with the proper justification letter. We could reimburse camps, but the only caveat with that is the camp can't accept waiver. And then also the camp needs to have a proper Department of Health permit. So that just to make sure that it's stated as like a day camp or a sleepaway camp, it has to be in New York State. It can't say like preschool program or anything like that because that wouldn't be considered a camp. But if you do have questions about, whether an item's reimbursable or not, we're very happy to assist. Sometimes, I'm not sure, and I'll reach out to the person at OPWDD and say like, hi, we got this request. Is this something that we could typically reimburse? If your child doesn't have waiver, obviously there's no life plan included, so that's fine. You don't have to, have the item in the life plan. If your child does have waiver, then you would have to submit a life plan where it states, why your child needs that item or that activity or, whatever you're applying for. In addition to that, we would need a signed HIPAA form, just allowing us to discuss the application at our committee meeting. Typically, our committee meets once every quarter. Usually in the last quarter, we try to have 2 meetings. This way it gives like OPWDD some time to review and get back to us with any issues. And as I said, if we ever have questions or sometimes OPWDD will deny something and we'll try, fighting on your behalf to say like, no, should actually get reimbursed because of, whatnot. As I think Barbara mentioned, like we do want to spend the money. We don't like giving it back to OPWDD at the end of the year. So, definitely reach out to us and we'll try to help you make sure that whatever items are needed, if we get an application and it's missing something, we try reaching out and saying like, giving you a heads up, like we're missing this document, please try sending it to us as soon as possible, or the justification letter doesn't seem to be sufficient, like this is what the issue is. Like as I think Barbara also mentioned, the justification has to connect to the developmental disability. Often we'll get like a justification saying the child has like ADHD. We're like, but that's not the developmental disability. So PWDD will deny it if it's connected to like the ADHD or like to obesity or something like that. Some expenses that besides for the clothing that we've gotten is guardianship fees. And that you could actually apply for if you have self-direction as well, as long as the items in the budget. With self-direction, you could apply for specific items. Recreation activities usually can't be covered if you have self-direction. Clothing for children under 18 could usually be covered. And as I said, the guardianship fees, special fees associated with like special needs trust, things like that. Does anyone have any questions in regards to any of that?
No, I just want to say, Pearl, you just made Jackie Goldberg very happy because she did mention special needs trust, and I had said we had listed it before. And thank you so much for adding the age piece about self-direction, because we do understand with self-direction it can be a little confusing. How you can apply the process, how it needs to be added to the budget, and so on and so forth. Again, if you have self-direction or if you don't, if you have any questions, we are here to answer them. Reach out to the provider agency, reach out to your care manager, reach out to your broker, and ask these questions. That's, what we're here for. I think one thing that you'll hear repeatedly, and Pearl mentioned this as well, from each provider agency is we want to spend these funds. We definitely want you to get assistance in these out-of-pocket costs. Twofold, right? We want to help support the families with these services that we provide. But as a provider agency, we are also contractually obligated to meet these program requirements. So please help us help you. And reach out to us, as someone said before, via email for those that prefer it, or a phone call, however you prefer, and ask your questions.
Okay, great.
Yes.
Going back to a little, just some things I wanted to point out with applications that may delay the process. As it was previously mentioned, we have to submit a tracker. On the tracker, we have to list what items we're reimbursing for. Certain times we'll get receipts. Certain stores are very bad about listing what the items are. So they'll just say like girls fashion and something like that we can't typically reimburse because we don't know what that is. So when you get a receipt, try to shop at a store, let's say for clothing, that lists like if it's a dress, if it's a skirt, instead of just saying like, sports or anything like that. Because we do have certain items we're not allowed to reimburse for. Let's say we can't reimburse for accessories. We could reimburse for, actual clothing, but not for like hats, things like that. As somebody mentioned, we can't reimburse for delivery, shipping, taxes. Also, in regards to funding caps, in general, it's a $3,000 per individual funding cap, but not per item. So let's say your child attends $500 worth of swimming and 800 of gymnastics, and then you want to apply for 1,000 worth of clothing, that's fine. The expense doesn't all have to be the same type of expense. It's per child, not per item. Also, in Manhattan, this doesn't typically tend to be an issue, but funds are limited. So I would say to try to submit it as soon as possible. As I said, Manhattan funds are a little less limited. But if you happen to be on the meeting from any other boroughs, I would say the sooner you submit, the better, because agencies do have funding caps and limits. And once the money is spent, unfortunately, we can't give out additional funds. And then in regards to what are the most frequent reasons like applications are denied, I would say for the most part, those are just like if OPWDD denies us or because they say the expense can't be reimbursable. I know one of the things they've been giving pushback are for diapers. Technically, it is on the allowable list if Medicaid denies, like if you don't have Medicaid or private insurance denies it, or the Medicaid ones are insufficient and you have justification, but they're still giving a little bit of pushback with that. Another reason things may be denied is if you submit receipts from a previous fiscal year. So just make sure when you're submitting receipts, it's from July 1st through June 30th, the expense. Also, another thing that to be mindful of is that the parent who's submitting the receipts is the one who paid for the item. It can't be like a grandparent, bought a present or helped you out financially and paid for the item. You want to be able to reimburse that. Or if you used a gift card, unfortunately, we can't reimburse that item either then. And, since, as somebody mentioned, it is a contract with OPWDD, we have very strict guidelines we have to follow. We want to try our best to help. But we do have to follow the OPWDD guidelines. They have an ADM. It's accessible to anyone. It's on OPWDD's website. If you ever want to take a look at that, see when you submit the application, make sure that the application follows those guidelines. But as I said, we'll notice and say like, there's this issue if you want to try to rectify it, so we could get that reimbursement in. I think that's pretty much it between, what other people have already mentioned. I don't want to, like beat a dead horse. So.
It's okay, Pearl. And it's okay that the information will be similar, but I also want everyone to get an idea of the different agencies that support Manhattan. Put names to faces of who you can contact because we really want everyone to take advantage of reimbursement. You made a good point in that although funding is limited in Manhattan, agencies also want to use up all the money they're given so that we don't have to give money back the end of the fiscal year. The applications, as we're hearing, they require a lot of information, justification, the life plan needs to support what the request is and so forth. And so it's not something that we want to start last minute either. We have the whole fiscal year and we really want to encourage everyone to get that information sooner than later so you can work with provider agencies to get those applications in. And then, of course, if an agency ends up sharing they actually don't have any funding left, it is okay to work with another agency to see if they have the funding to be able to award the family reimbursement for the fiscal year. I just had one question, Pearl, just so it could be clear for everyone. I know that you and HRC have mentioned this tracker that has to be completed. I just want to be clear that tracker is done by the provider agency. You're just working with the person who submitted it to complete it for your, on your end.
Correct. It's just more like this is things that OPWDD requires. So when we get an application, we make sure that we have all that information to put in the tracker. Because OPWDD does look at that tracker with like a fine tooth comb. Like they'll look at each item. We try breaking it down as specifically as possible. So this way they don't come back to us and deny something because they, lack clarification on that item. This way they have it. Also, if OPWDD does deny something, there is a process where a parent can appeal. They could submit additional documentation. I believe it's within like 15 days. I might be off on that timeline. And then that actually goes up, I think, to Albany then. So it's not just the local DDRO reviewing it. It goes up and hopefully Albany ends up approving it. If not, there is still another like step that they could try appealing that as well.
Well, that is welcome to take note for
Thank
HRC.
you,
So
Pearl.
thank you.
Huge piece there, a very important piece that you mentioned, the ability for people to appeal a decision. And that's part of that was put in the ADM that came out in 2022. And every agency has that process. And if you want to know how it works in a particular agency, just again, reach out. So thank you so much for bringing that up, Pearl. Very important. And Manawati, I just wanted to add to the piece that you said regarding if an agency does run out of funds. First of all, congratulations to you, agency, if you do. I also just wanted to make it clear, if you hear that the agency has run out of funds, again, there's multiple provider agencies that have this program. But for the provider agency, if you have run out of funds and you still have applications, please reach out to your fellow provider agencies and let them know, hey, we've run out of funds for this borough. However, we were left with an X amount of applications. Do you have funding? We're about to reach out to these parents and let them know who still has funding and where they can go, so that we're helping each other out as well.
Just could I say a piece to that? I believe the past 2 years, OHL has done that also in Brooklyn and in Queens. Like if we run out of funds, we try reaching out to other agencies and just sending the application over to the agencies. But we try getting parent consent first before, sending it to a different agency.
Oh, we benefited, so we're definitely grateful from that. But for all other agencies, again, if you are lucky enough for a particular borough to run out of funds, just please reach out to your fellow provider agencies. Because again, we definitely want to support as many families as we can with this service because it is a great program. And we definitely want families to take advantage of the fact that this is, if not the only OPWDD funded service that gives you direct funds, at least one of the few. So definitely take advantage of that. And with that, back to you, Manawati. I don't know, Pearl, if there was anything else you wanted to add or.
I don't think there's anything else I wanted to add. I'll put my contact in the chat, and then I'll also put Erica Friedman, who's the direct supervisor of the of the program in the chat. The other actually small point I'll make is, especially now for families who aren't getting that OPWDD waiver approval, this is a really good resource for them, specifically because I don't know, right now, like the limited liability exception respite, it's kind of on pause also for families. So this is a way, if they are also paying out of pocket for respite, they could try applying for respite reimbursement. There is a separate respite reimbursement form that would have to be submitted with the application. The parents should just bear in mind that OPWDD may cap the amount that we're able to reimburse per hour for respite, like if it's considered like a reasonable rate. And then the other thing is they might also, depending on the DDR, I will make note like they might not let us do certain hours of respite reimbursement, if it's considered like late at night and there's no emergency or anything like that. But family reimbursement is definitely a good resource for these families to tap into until they get, other services, or even once they get other services as well.
Thank you, Pearl. Really good information. And I also did put in the chat the OPWDD website where you'll find all the information about reimbursement, including the application, allowable, non-allowable list, the regulations surrounding it, and that respite form if needed that Pearl was referring to. I've also added our Manhattan DD Council site as well as our directory for where you can find all the agencies that participate in family reimbursement in Manhattan. Thank you so much, Pearl. It's really appreciated. Our next presenter is from CUSAC, Genesis Rosado. Genesis, I did give you co-host abilities in the event that you had to share your screen. But the stage is yours.
Share real quick. Can you guys see my screen?
We can, yes.
Okay, awesome. I'm gonna try my best not to like reiterate what other people have said, but again, this is also like important information that everyone should know, so it's not like, yeah. So yes, CUSAC family reimbursement. The point of contact for CUSAC family reimbursement is me, myself, Genesis Rosado, and then my supervisor, Brittany. You can email us any questions you need. You can email us. We can send you like applications if you have any questions. We will be the point of contact for that. And then the guidelines, like other agencies have said, we will need the OPWDD eligibility, the completed application, the receipts and invoices with specific items that are being requested, the date of purchase with the date of purchase for each receipt. The dates need to be dated from July to June, justification letter from the parents, and then in some items, clinical justification letter, and then the life plan with the justification letter in section 1, and then our contact information in section 5. Yes, and then if there is individuals who don't have OPWDD eligibility, CUSAC also supports and help with getting OPWDD eligibility and other supports that we have with that. And then our allowable list, it's the same thing as OPWDD's allowable list. Most common we get is like recreational classes, cooking classes, karate classes, dancing classes, swimming lessons, sensory items. All of those things can get reimbursed. And then for like special circumstances, these are like circumstances where you would need the clinical justification. So like for clothing items or like a mattress, those items would need like a clinical justification, and usually a justification that would be appropriate for those items would be like an incontinence issue or a behavioral issue, you dealing with like chewing or like ripping clothing items and stuff like that. Or in some cases, like if you wanted to get a mattress reimbursed, sometimes if you have a bed bug problem, then that can be like an emergency reimbursement, so that can be justifiable. And then for like medical needs and stuff, as long as you get the denial letter from the insurance, then we can justify that, and that would be that we can get reimbursed for that most of the time. Yes. And then non-allowables, we don't really do like furnitures, or we don't do taxes, we don't do transportations, and then these are some of the ones that they have on the list, on the OPWDD list. And then some of we can see if some of the like healthcare and like personal care things, like we've gotten diapers reimbursed sometimes. As long as you get like the insurance denial letter, then we can work with OPWDD and trying to get that reimbursed. And then like the whole process of, we all know it's a long process. It has to go through 3 reviews. First, we review it, then we send it to the committee, and then we send it to OPWDD through the tracker. The entire process could take up to 1 to 3 months, depending on how much like applications we are getting in. We also serve like all of the boroughs, Manhattan, Brooklyn, Bronx, and Queens. So we do get a lot of applications. So once we get the final approval from OPWDD, we'll send the team, like the care management team and the parents team, and the parents approval letter, and just letting them know the remaining balance that they have with us. And the cap is $3,000 again. And then after we get the approval, we work on the check request. And then this is just like an example for a clinical justification letter. In the example, it just mentions how like the individual has continence issues requiring an overturment of clothing, which is creating a financial burden on the family, or like behavioral issues and stuff like that. And then this is just like an example of like the application. So it's the first information, and then the amount you need, what are you asking for to get reimbursed, and then have any other services, and then the justification would be down here at the bottom, or you can add more space for justification. Other questions with if it was denied, then we will work with OPWDD. Sometimes if I have like a question, if like an item that is not listed on the non-allowable or allowable list is not on there, then I will like let OPWDD know. Like I'll call them like, hey, let's work on like how can we get this approved. Again, we do want to spend the money, so we will try our best to get whatever you need to get approved. We do work with like translators and interpreters. I also speak Spanish. And then we work with care teams and care managements. Most of our interactions would be through email. So you can email me everything, receipts, applications. We also accept things through the mail, so you can mail it to us. And then like self-direction, as long as it's in the budget, then yes, we can get reimbursed. And I think that's it.
Thank you, Jennifer. We can't speak for all of care management, but we love a good example. Would you be able to share your slides with us so we can definitely, I think it's really helpful to see what that justification, or what are the important things that you want to see in a justification letter so they can ensure to advocate. Because from my experiences, I will tell the doctor, we needed a clinical justification, and they're like, so what do you need in there? And we're all just at a standstill because we're not entirely sure, and then we start working. So if you could share that, that would be really helpful.
Yeah. I also like sometimes I have like doctors on a phone call, and like or the doctors and the parents on a phone call 3-way, and I'm like telling them, okay, this is what the justification letter needs to have. This is like for sure would know how to get approved, and that helps a lot of times. Or sometimes I sit with the parent if they're struggling with getting like a parent's justification letter. I sit with the parents and like, okay, well, how is this item going to support your child who has developmental disabilities and stuff like that.
Wonderful. Thank you so much. We really appreciate it.
And I'm sorry, I just wanted to add, Genesis, thank you so much for pointing out the language barrier that may come up with non-English speaking families. It's great that you have bilingual staff. But I do also want to mention on the OPWDD website, the family reimbursement application is available in 14 languages. So please be sure that if the family requires the application in a language other than English, or Spanish, I think, which is or Mandarin, which I think are typically the 3 most popular ones, depending on where you are in New York City, honestly. Please be sure to visit the website or direct families to the website so that they can get an application in a language that they're more comfortable with, or is their primary language. And the instructions on how to complete the application is also in multiple languages as well.
All right, great. Thank you so much. And we have our last presenter, Miriam from Synergia. Miriam, I did give you co-host abilities if you needed to share your screen, but the stage is yours.
Hi, how are you? So we actually have our family reimbursement coordinator, Hercaudi Lara Nivar. I don't know if she's able to share her screen.
I would have to give that person,
Hi, it's me. Hi, everybody.
oh, hi. I'm gonna give you abilities right now. Give me 2 shakes.
Thank you so much.
In the meantime, Genesis, if you could drop your information as well in the chat, that would be really helpful. Oh gosh.
If not, I can totally share my screen.
No, I got it, I promise. Okay. All right. Okay, you should have ability now to share your screen, Jakardi.
Okay, give me a second. Let me just make sure that everything's okay. I will start sharing right now. Can you guys see?
Yes.
Okay. Wait, let me see. Oh, I can't move it. I don't know why. Oh, okay. So, hi, my name is Hercaudi Saranivar. I'm the Family Reimbursement Coordinator. I just got assigned this role at beginning of this fiscal year. So, it is good to be working with you guys. So, this is Synergia. We are a nonprofit organization serving people with intellectual and developmental disabilities and their families in New York City for almost 50 years. Synergia works with underserved families, many with limited English proficiency, low-income families who may be homeless or impoverished, or who have maybe struggling with secure housing and income and experiencing lack of services. Synergia has remained true to its goals since it was founded in 1977. We provide service coordination, information, and support to families and individuals in need. We provide families and individuals the means of self-empowerment to help them become advocates for themselves and their families. Synergia offers Medicaid waiver services for those who qualify, and we also have the Metropolitan Parent Center and its Autism Initiative program, which serves the families of children and youth ages 0 to 26 who have diagnosis of or are suspected to have intellectual disability or developmental disability. So our family support services funded by OPWD, we have non-Medicaid case management, service coordination. We have evaluations for families who reside in Manhattan and who don't have Medicaid or have private insurance. Our family reimbursement program, which is this presentation is on, and educational advocacy for Manhattan families only, and also housing advocacy. You have our contact information at the bottom, and if you have any questions, I'm going to leave my contact information in the chat as well. So our family reimbursement program, family reimbursement program provides funds for goods and services that are not available through other existing public assistance program and or resources. Applicants must have a developmental or intellectual disability and be OPWD eligible and provide original invoices. Client must reside at family home with one or more non-pay family, and we have a cap of 3,000 per fiscal year, which runs from July 1st, 2025, June 30, 2026. This is our fiscal year, and as everybody has said, we like for you guys to receive this fund, so please send your applications, and we're more than happy to help you because we don't like giving it back to OPWD. And then we have funds available at the moment for all for our boroughs, Queens, the Bronx, Manhattan, and Brooklyn. Our most common service requests are clothes and shoes. We need a justification letter for that. And we need the receipts. As Ms. Robbins said, please make sure that the receipts are legible. We and shop at stores that says exactly the item and the price and the day that you bought those prices. For example, I've had luck when families shop like at Primark, at Children's Place, at Walmart, at the Gap, Target, because we get, they get those little numbers and we can look them up in the website if we don't know exactly what it is. But if you shop at, I'll say 99-cent store, we are not able to see exactly the item, and then we won't be able to reimburse for that. So if you can be as clear as you can when when shopping at the store, so we can be able to reimburse, because if not, we won't be able to send them through. And then another things we have is mattress and box spring service purchases and replacement. So those are the only bedroom furniture that we can reimburse for. We need a justification letter explaining exactly the reason why, how that item or service, how that item links to their diagnosis, and what symptoms of their diagnosis causes them to be either break or destroy their the mattress, and the reason why they need it. So we need a very detailed justification letter when it comes to mattress and box spring purchase and replacement. We also have recreational program, swimming therapy, taekwondo classes, and music therapy. I don't know who said, somebody said it here that they don't require a justification letter, but we do. For swimming lessons, for any recreational program, we do. And we also when sending the invoices, we need a detail exactly on how many classes, how much you pay for each classes, the time of the classes, because OPWD will require that information in the tracker. If not, then we won't be able to reimburse for that for those services. So applications must be completed at its fullest. We need it must include the receipts. Please make sure that the receipts are legible. You can send pictures, or you can send like the screenshots of the receipts if you did purchase online. But for the screenshots of the physical receipts, please make sure that it says the date that you bought it, who bought the clothes, because usually it says, like, it will say the name of the mom who bought them, the date where you purchased the item, the price, and at the end the full, like, the amount that it made, all of it. We do not reimburse for taxes. We do not reimburse for discount for like, say for example, let's say if the item got discounted, we will reimburse for the actual price that you paid, not the full price of the item before the discount. And yeah, just make sure that the receipts are legible and they are clear for us to understand what you purchased at the store. Justification letter from the doctor. So great example for Genesis that we saw, it was really good. The justification letter. This is our most the part of the application process that delays most of the application. Why? Because the OPWD, they're very keen on what they want on their justification letter, and most doctors, they don't take the time to be detailed on what it is, or either the provider of the services. So justification letter from the doctor stating the diagnosis, the need of the benefit, the need or benefit of the items and service requested. For example, when we request a justification letter for swimming, we receive the diagnosis, the usually they'll say like how long they've been with the doctor and how swimming helped them. One of the things, like, oh, it helps with motor skills, it helps with interaction, social skills, because you get swimming. So things like that will help the letter. Life plan if applicable. So because OPWD is right now, they're very I'll say choosy with who receive waiver services. So if you have a life plan, we need the justification letter being implemented in the summary of the life plan. We need our agency, Synergia, stated in section B of the life plan, and yeah, that is mostly it. And if you don't have a life plan, then we're good with the eligibility letter. So there is no waiting list. Parents are notified of their application status every step of the process. Everybody has, let me reiterate, it is a big process. We, for example, in our agency, I'm the primary contact. I receive the applications. I check the receipts. We try our best to review every documentation so that we don't have to be sending denying the application. So we don't officially deny. So if we receive let's say, a justification letter in the life plan and something is missing, we will get in touch with you and let you know that this is something that you need to be fixed. So when it gets to OPWDD, you don't get denied, because then there will be, it makes the process longer. So approvals and denials are sent to parents. Denial letters, which includes with denial letters, they include the reasons and the next step for you to appeal for if the reason is not appropriate, and you have 15 days to do all you will receive the letter 15 days from the purchase of the item, and then with every application, to ensure that you don't get denials, we consult the ADM every time. Which the ADM, it is also to ensure that we are compliant with OPWD guidelines and avoid denials. When I since I'm in the primary contact, when I receive questions from the parents and they request an application, I send them the applications, the non-allowable and allowable list, and the ADM as well with the list of the required documents, so that they are aware of what it is that is needed, and if and that they can read the ADM for themselves and see what it is that OPWD requires. Bilingual assistance is provided, and for those with limited technology access, we have appointments available for them to come to the office, and we complete the application as well and review the whole application in its entirety here at the office. I am bilingual. I speak Spanish and English. For those for language outside of my expertise, we have interpreter and translators, as well as we can always find the resource to make sure that the parents have the service that they need, or have access to the service that they need. Application reimbursement must be made within the fiscal year with which items or services was purchased. Reimbursement will not be provided for items or services purchased in previous or upcoming year. It is strongly encouraged that all reimbursement requests that were not made within the fiscal year, so from July 1st to June 30th, they should be submitted within the 90 days of the start period of the new fiscal year. I strongly suggest to make sure that if you're going to apply for reimbursement last minute, to either do it at the beginning of the fourth quarter or June 1st, so that we are able to get through it and through all the whole process, because at the end of the day, there are going to be applications that are going to be missing out on the funds because they don't fit within the 90 days. And we ourselves have a process, OPWD have a process, we have a committee, and it's a big and lengthy process. We would like to ensure that we get to all the families and we don't miss nobody out. We have emergency reimbursement, which supports available natural or community resources typically funded through other mechanisms that may be allowed on a short-term basis with appropriate supporting justification. Family reimbursement is not intended to cover chronic, ongoing crisis situation. We do subsidy for housing, utilities, food, clothing, and through medical goods. What we require is documentation sustaining the need, for example, an eviction notice, letter of justification from care manager, description of how the request address short-term addresses short-term crisis that impact the health and safety of applicants, and a plan to prevent reoccurrence of the crisis. Last year, we had this case with an eviction of a family, and they followed through with the OPWD requirements, and we were able to reimburse them the money. And just to follow up, I didn't add it in the presentation. The application must also reflect emergency reimbursement needs by indicating yes or no in the application, and that emergency request funding is separate from the 3,000 statewide cap for the family reimbursement. Other services that we have that require OPWD eligibility: community enablement, day services, employment services, family care, residential services, freshman services, and that is all for us. I also want to let you guys know that oh wait, my train of thought just if we, like, for example, some families who don't have the chance to make it to care CCOs, for example, we have care management for Manhattan, Brooklyn, and Queens. So if your care manager, case management, we have case manager. If your case manager was able to help you with the OPWD eligibility, they should inform you about like the 3 services that you don't need waiver services for, and in any case, they can help you with the application process. So get in touch with your case manager. They're gonna help. They're gonna give you all that information, and yeah, that is all that I have for our agency. If you have any questions, please let me know.
Thank you so much. And Miriam also had put your information in the chat. We really appreciate it. And it's nice to hear that families can also come to your office and be supported with the application process. Thank you. And so we're going to have one more presentation by Wendy on behalf of ADAPT and their reimbursement program. And then I just also want to remind folks to please also join our monthly Manhattan DD Council meeting. Our next one is going to be January 27th. It is a hybrid, so you can join virtually or at our meeting location, which is on the Manhattan DD Council website. All right. Do I need to give you my co-host abilities?
No, 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 I won't be
Oh,
sharing any slides or anything like
okay.
that.
No.
So hello again, everyone. My name is Wendy De Leon. In addition to being the co-chair of this committee, I am also the Director of Housing Assistance Services at ADAPT Community Network. So I just wanted to, add our hat to the group of folks that have been presenting today on family reimbursement. ADAPT Community Network has its own family reimbursement program. We provide family reimbursement to all 5 boroughs. And our contact person is Danielle Raymond. I put her contact information in the chat. I did just want to say you've noticed that it's basically very similar, about 90% of it, from agency to agency in terms of how you apply, the documentation that needs to be submitted, the things that are reimbursable and the process of review and so on. What I did want to add regarding ADAPT, or at least add on to some of the stuff that's been shared, is we do get a little pushback sometimes when we ask for additional documentation from families, and I just wanted to kind of respond to that. Some of the pushback that we get is when we ask for more verification of payment or proof of payment. So there's a couple of ways to do that, right? If you go to a store and you pay cash, the receipt is pretty straightforward. The receipt will say you paid cash. That's all there is to it. If you say you're the one that purchased it, then you're the one being reimbursed, right? However, when you pay with a credit card, all it says is the last 4 digits of the credit card. That credit card could belong to anyone. So in an effort to dot our I's and cross our T's, we do ask for a copy of your bank statement, because the bank statement will then say, yes, this person used this account to go to this store and purchase this amount worth of whatever. So if you send us a receipt that shows all the items and then says credit card payment, the receipt totals $58.59. You send us a bank statement. It shows the same date, the same store, the same amount, $58.59. We know they match, right? That's the reason why we would ask for a bank statement. It's not to make things more difficult. It's not to add on to the amount of paperwork that you need to submit. It really is just to make sure that things align across the board, because OPWDD will ask, right? They may not ask for you in that moment, but every provider agency gets an annual review from OPWDD, actually from the regional office itself per borough, and we must account for what we have done and how we did it, right? So that's why we ask for this documentation. It's not only that OPWDD requires it, what they really tell us to do is make sure that the people are reimbursed. What we have to do is make sure that we're reimbursing the appropriate person. And I want to add to something someone said about other people purchasing items. So your household could be made up of many different people, right? It could be grandma, it could be aunt. Who is to say who's purchasing items for your child, right? And who's entitled to that reimbursement? Grandma can pay for the child's whatever it may be and ask to be reimbursed for it. However, again, we would ask for the documentation. There's the receipt. If they paid for with credit card, we would need the bank statement, an explanation that, hey, this is grandma and grandma was the one that purchased it, and therefore grandma's the one being asked to be reimbursed. Understandable. You could be separated from your child's father, right? And the father lives in a different address, and they're buying stuff for their child. And so even though you're the one submitting the application, because you're the one that gathers the life plan and goes to the meetings and knows about the family reimbursement program, but the father's the one that would like to be reimbursed. Again, that's possible. You just have to submit the appropriate documentation that goes with that. And again, explain why, this there may be some discrepancies in that you put the child's address as this, but the person who's trying to be reimbursed has, a different address on their bank statement or whatever it may be. So I just wanted to put that out there. We are just trying to make sure that things make sense and that the appropriate documentation mirrors what all the other documentation is saying. So that might be why you could be asked for more documentation than what is typically listed. So please just keep that in mind. I cannot stress this enough. I know a few people said this about receipts. Please be sure that the receipt is clear. These receipts tend to be, what is that called? Someone help me out here with the heat sensitive. So after a while, they tend to kind of erase. One other reason why maybe you should apply for reimbursement as quickly as you can, right? If you keep a receipt in your pocket or your purse or wherever for a few months, you may see that half your receipt has disappeared. And then that renders it useless, and then you can't use that for reimbursement purposes. But please be sure that the receipt is clear, the name of the store is there, the date is there, the form of payment is there, and that the items that are purchased are clear. In addition to that, we know, especially when you have a larger household, that when you go purchase, you're not just purchasing for one child, right? If you have 3 kids, you're gonna buy clothing at the beginning of the school year. You're gonna buy for all 3 kids, not just one. So it would be helpful if you could highlight which of the items you're trying to get reimbursed for. I do believe that the application does ask, or at least it did before, like the size of the child. Correct me if I'm wrong, because I haven't looked at the application in a minute. For those of you that are consistently looking at it all the time. But it would be helpful if the items that are actually pertaining to the child could be highlighted in some way. A little asterisk, a little star next to it, maybe highlighter if you have those kind of office supplies in your house. It would go a long way to kind of point those things out. Because I can't tell you how many times we've had to go back and say, all right, this says large, but the child is 6, so that doesn't quite add up. So just a couple of those things I wanted to point out. But other than that, the application process for Adapt Community Network is the same. Again, the general application is available on the OPWDD website, or you could reach out to Danielle and she can send you an application, either by email, by mail, however you prefer. We still use fax. We can fax it to you if you'd like. E-fax, but we can definitely get you a copy. And the justifications and so on are all the same as the other agencies. I want to finish just by saying we've all said sort of certain dates where we would prefer to receive applications. That is not to say that if it's June 29th or June 30th and you have an application to submit that you shouldn't. By all means, please do so, because the receipts cannot be used for the next fiscal year regardless. So you're better off trying than not. But the earlier is definitely better. It just guarantees that we have the appropriate time to really go through the application the way we should, and if we have to follow up with you for whatever, that you have the time necessary to get whatever supporting document you may need to get. But if you do happen to get all the way to June 30th and you look at the calendar and you're like, oh my goodness, I haven't submitted it yet. Please don't let that stop you. Please do submit the application regardless. We will do everything that we can to get to it. Because again, those receipts do not transfer to the new fiscal year. So either you use it during the current fiscal year, or you lose the opportunity to get any kind of reimbursement for those items. And that is all I wanted to say. So thank you for the opportunity.
Yes. Thank you. Thank you so much. Again, we've put all the information that we can for the presenters, for the Data Council, for the information we referenced today in the chat. Please give us some time for us to just figure out how we can get the information for all the participants so we can email you out the slides that we received, the slides for today's presentation. As well as, again, please feel free to contact myself, Wendy, or any of the presenters that presented today who have listed their information in today's chat. I don't think I saw any other questions. I know we have 4 minutes. Did anybody have any
Can I
questions that
add
they wanted
something
to?
for?
Yes, go ahead.
Yeah, sorry. I noticed that nobody really touched on it. So when doing like classes and stuff, so we reimburse after the participant has attended the classes. So sometimes we have like summer classes, like summer camps that they pay in advance, but we cannot reimburse those until they finish the entire like dates of it. Something I like to do is to like break it up in like months. So like let's say it was like a winter program that ran from like January to February. I do it monthly, so they'll get a monthly check for January and then a monthly check for February. And then in some cases, because the cutoff is in July and June, so we would have to like break that up. So it would be from one half of it would be for one fiscal year, and then the other half would be have to do for the second fiscal year because it kind of overlaps it. But like just letting you guys know that we only reimburse after the participant has attended those programs.
Thank you, Genesis. I think there's a couple of agencies that do it that way. And the thought is you're reimbursing for a service that's been provided. For those of you out there who are questioning why that is, you're reimbursing for a service that's provided because honestly, things can happen, right? You sign up your child for a class that may not start for 2 months or a camp that may not start for 2 months, and then something happens and you never send your child to that camp or to that class. And so, we don't want to reimburse for a service that never took place. So that that particular practice is in place. And then obviously if you paid out of pocket for a service that wasn't received, I would definitely encourage you to try to get reimbursement from the program directly as quickly as you can. But that is the thought process behind that. And if you have any questions or are confused by why things happen the way they happen, please ask. We're more than happy to explain what the process is. We definitely need your buy-in in order to make this program work. So if you are questioning why certain things are being requested, why certain questions are being asked, by all means, I mean, we should be explaining that to you regardless, but if we're not explaining it to your satisfaction, by all means, please, reach out. You can set up an appointment, you can set up a meeting. The number of times that Danielle has met with like a care manager and a parent to try to kind of address all the concerns in order for us to be able to process an application. That's what we're here for. So by all means, please do ask. And I also wanted to add on, first of all, thank you to all of you representatives of provider agencies that were able to join us and to speak about your respective programs. But Manawati did put in the link to the Family Support Services Directory, which has a full list of the organizations that provide family support, family reimbursement. Please be sure to visit that link and you can see the full list of the provider agencies. You can always stick to the one that you know, by all means. But if you're not familiar with them or for whatever reason, you may not want to go to the one you applied to last year, there's there's like 3 pages worth of provider agencies, I think, that provide family reimbursement. So by all means, please do check that out. And then Jacoudy, I think I saw your hand up. I'm not.
No, I was gonna say that there might like if just as the same thing for the parents and the care manager, we FSS providers, if we don't know something, we will always go to the DDRO to get sure to make sure, like I said, we are trying to get this money out and we are here to help the family. So we will make everything possible to ensure that all of your documentation application are in compliance to OPWD so that you can get the reimbursement. So if you have a questions and you even if you read the ADM and you see the non-allowables and if you have a questions that might get something like you that there's a way for you to get something reimbursed and we don't know, we will go to the OPWD and inquire and we'll get back to you because we need to get this money out because we would like to help the family. It happened to me with some furniture that is not in the list. So always get in touch, ask the questions, and if anything, we're here to help you.
Thank you. And I'm sorry, I'm being very talkative this time around. I just also wanted to add, if you as a parent or even a care manager, representative, someone's working to support an individual with IDD, don't see something listed that you believe should be covered, if you have any feedback to give, please do join these committee meetings. This is where things are discussed and noted so that we can then bring them up to OPWDD whenever these quarterly family support service meetings are happening or whenever we have our annual reviews and we're sitting with a DDRO liaison talking about how the program went and why we had to send back certain applications, what we were seeing, what was the trend. Join your respective family support services advisory committee meetings that happen for every borough. These are parents representing other parents who also advocate on your behalf to try to make improvement on these services and the things that we can do for you and your loved one. And if no one else has any questions, anything else to add, on behalf of Manawati and myself, I just want to thank everyone for joining us today. For the provider agencies, if you didn't have a PowerPoint but would like us to include your family reimbursement flyer when we send out the link for the recording and our own PowerPoint, please make sure that either myself or Manawati or both of us receive a copy of your flyer in the next couple of days because we would like to get this information to folks no later than next week. Thank you all for joining us today. And we hope to see you again in our next meeting, which will take place in March. Keep an eye out for the email we will be sending out with the specific date and topic. And if not, we at least hope to see you at the General DD Council meeting for Manhattan that will take place on the 27th. The link and information is in the chat for you. Again, thank you so much for joining us. We hope you have a great rest of your day.
Thank you.
Thank you.